Cleaning and caring for your tracheostomy is a critical part of everyday maintenance. The tracheostomy tube must be cleaned at the beginning of the day and again in the evening prior to bedtime. There are several different types of trach tubes and brands. Some tubes have balloon cuffs around the body of the tube. Some do not. Some are metal and some are plastic. Some are made out of silicone and may have a cuff. The cuff in the silicone trachs are tight to shaft, meaning that when they are deflated, they disappear into the body of the trach tube. Some cuffs have a higher profile, even when deflated. Some have an inner cannula, or sleeve that pulls out of the body of the trach tube. You can use a self-contained kit, which has most of the supplies you'll need. If you don't have a kit, you can purchase most of these supplies at a local grocery store or pharmacy. You'll also need a few items delivered from your home medical equipment supplier. Here are the supplies you'll need: distilled water, hydrogen peroxide, cotton swabs, paper cups, brushes and pipe cleaners, a clean towel or chucks, and a pair of non-sterile gloves. From your medical supplier, you will need a split drain gauze pad, a 2x2 square gauze pad, and additional gauze pads for cleaning. Before you get started on any procedure, be sure to wash your hands thoroughly for at least 20 seconds with soap and warm water. Now you're ready to get started. If you have a kit, open the package by peeling off the top cover. Unfold the paper padding to create a clean work area. Unpack the supplies and place them on the clean paper padding. Place the brush and tube cleaners in the large basin. Place the cotton swabs in the small basin. A trach tie will be included in the kit. Do not use this tie. Craig Hospital recommends using a Velcro tracheostomy tie. You do not need to change the tie at every cleaning. Change the trach tie if it gets wet, soiled, or change it when you do a tracheostomy tube change. Fill all 3 basins with distilled water, about half full. Fill the basin with the brushes and pipe cleaners, about half full, with hydrogen peroxide. Pour a cap full of hydrogen peroxide into the small basin containing the swabs. Put on clean gloves included in the kit. It's recommended to double glove over existing gloves. Be careful not to touch the fingers on the clean gloves. Slide your hands in gently. If you have a trach tube with an inner cannula, remove the inner cannula and place it in the large basin with the cleaners and the brush. Let it soak while you clean the stoma, or the area where the trach is inserted into the neck. Keep the patient clean by placing a clean towel or chucks on the patient's chest. Use the swabs that are soaking in distilled water and hydrogen peroxide to clean around the hole or stoma. Gently grab the flange of the trach tube and pull it away from the stoma slightly, and clean the top of the stoma from corner to corner. Gently pull away the other side of the flange and clean the bottom of the stoma. The bottom of the stoma is where most of the drainage will collect. You may need several swabs to clean this area. Make sure the tissue looks healthy and is not red or infected. Take a clean gauze pad and saturate it with distilled water. Gently pull the trach out and wipe off the top and bottom to remove any remaining hydrogen peroxide. Use a dry gauze pad to dry off the bottom and the top of the trach. Use the pipe cleaner to clean any secretions inside the inner cannula. Use a clean pipe cleaner for each pass. Use the brush to clean the inside of the tube thoroughly, making sure to remove any dried-on secretions. Push the brush all the way through. Submerge the cannula into the basin of distilled water to rinse out the hydrogen peroxide. Let it soak for at least 3 minutes. Use clean gauze to dry off the inner cannula, removing as much water as possible from the inside. It's okay if there are a few drops left inside the tube. Once the inner cannula is clean, insert it back inside the trach tube. Make sure the cannula is secured. Now, use the split gauze drain to dress the newly cleaned trach tube and stoma. Gently tuck the gauze under the flange on one side and then the other. Grab both of the tabs gently and secure it into place. And you're done.